Most patients will spend 3 to 5 nights in hospital after a knee replacement. The high majority of my patients then choose to go straight home. In fact, the safest place for most patients to recover is in their own home. If you have specific health needs or just require a little bit more support, you have the option of an extended period of rehabilitation within a hospital. The nursing and physiotherapy staff at SportsMed are absolutely amazing, as everyone is specifically trained and very experienced in helping you to recover from joint surgery. Every patient has a private room, ensuite and free Wi-Fi. There is a reason SportsMed has twice been rated the #1 private hospital in Australia, and my patients constantly rave to me about the positive experience they have at SportsMed. You are allowed to stand up and walk on your new knee as soon as your pain control and strength allows you to do so. Most patients will aim to at least sit out of bed, stand and shower the day after their surgery. A physiotherapist will work with you every day in hospital to get you up and moving, and also to provide a basic game plan for your rehabilitation in the weeks after you leave hospital. Rehabilitation begins from day 1 of your surgery. It is vital that you take control of your own rehabilitation. Patients who do this often get up and going more quickly and regain better knee range of motion. We are all here to help you, but you do have to take some responsibility and ownership. Do your exercises a minimum of 3 times per day. If you would like to talk to me about your knee, then please call my rooms at any time. If you haven't already had appropriate scans, I can easily arrange for these to occur before your appointment.